Hi, Assalamualaikum, and we meet again. Okay, today I will talk about the topic tiptoe. Okay, first, what is the tiptoe? Okay, tiptoe is refers to condition where a person walks on their toes without putting much or any weight on the heel or any other part of the foot. And actually tiptoe in toddler is common, which is children who tiptoe walk as toddlers commonly adopt a heel toe walking pattern as they grow older. And then if a child continues to tiptoe past the age of 3 or can get their heels to the ground at all, they should be evaluated by a health professional who is experienced in assessing children tiptoe. Okay, now I will talk about the cause of tiptoe. Actually, has 6 causes, and the first one is 30 until 40% of cases is a family history where tiptoe is a diagnosis of exclusions, meaning that there are no underlying medical conditions contributing to tiptoe, but the cause of the tiptoe is unknown for now. Okay, and the second one is about tight calf muscle on the back, where generally associate with tight calf muscles on the back of your child's leg. This tight calf muscle will decrease the movement of the ankle and will create pain and instability in the knees and hips. Calf muscle becomes tighter as a child continues to tiptoe, and this is why tiptoe walking can become worse with time. And if tiptoe become worse, it's also become worse difficult to treat. And the third one is caused by muscular deficiency condition, where is also associated with certain neurological, orthopedic and muscular, where deficiency conditions such as autism, hypersensitivity syndrome, congenitally shock Achilles tendon, which means therefore it is necessary to establish that there are no underlying medical conditions contributing to the tiptoe before a diagnosis of idiopathic tiptoe is made. Okay, and the fourth one is learning to walk. Actually, it's common to tiptoe for toddlers age under 3, but they will walk nicely when the age is older. Then the fifth one is Achilles tendon is tight, and the last one is neurological disorders. Okay, now is about signs of tiptoe. Actually, it display a pattern of walking where their heels do not make contact with the ground and remain on the toes for each step. That means running gait usually appears normal, and if instructed to walk on the heels, child is usually able to do this. And when tiptoe persists, the ankle joint can become stiff and the calf muscle and Achilles tendon shortens, where there can also be widening and enlargement of the forefoot, such as ball of the foot and toes, due to exercise weight bearing, and the heel bone may be small and narrow due to a lack of weight bearing. Okay, now is treatment of Tiptoe. Okay, actually they have 6 treatment that are current use in today. Okay, and the first one is full length gait plates and stiff shoes, where there are several conservative treatments options available, including evidence-based treatments such as full length gait plates and shoes which encourage heel contact during walking. This may be complemented by stretching, exercise, and gait retraining techniques. Okay, and the second one is physical therapy, where a physical therapist works with the child on stretching the leg and foot muscles. This can help reduce tension and increase range of motion of calf and also the leg of children. And the third one is vestibular stimulation and sensory integration, where a physical or sensory therapist may recommend that your child swing, spin, or engage in other actions that stimulate the vestibular system to enhance the muscle of the leg and also the ankle and calf of children, and it will help to reduce the Tiptoe also. Okay, and the fourth one is wearing prism lens, where where displays the person's field of vision up, down, left or right. Part of vision training program and typically lasts for 1 year and involve wearing prism lens and performing daily visual motor exercise. After completing the program, the individual no longer needs to wear prism lens. Okay, and the fourth one is and the fifth one is casting, where another treatment used to stop Tiptoe, where this procedure involves wearing a cast to stretch out the tendon muscle. In most cases, the cast is applied every 2 weeks for a total of 6 to 8 weeks, and is regular to use with children that have Tiptoe. And the last one is treatment surgery, where a surgeon may lengthen the muscle or tendons in the back of the lower leg, and this option is usually only recommended when other therapies have failed to reduce the Tiptoe. And this one is the last choice for the all treatments for Tiptoe. Okay, and also is alternative treatment for Tiptoe. It have 2 alternative treatment that involving stretching exercise and straightening exercise. Okay, we talk about the stretching exercise first. Actually, it have 5 exercise. That the first one is gastrocnemius stretch, and the second one is soleus stretch, and the third one is heel drop, the fourth one is triangle stretch, and the fifth one is cross leg, which is the all exercise is involving a whole body from top and bottom to stretching the muscle to encourage children walk without Tiptoe. Okay, now is alternative treatment involving strengthening exercise. Actually, there are 3 treatment, and the first one is bridging. The second one is squats with heels down, and the third one is sit to stand. This treatment also to encourage children to reduce the tiptoe and to enhance their walking properly, and to straighten their calf and tendon muscle to help them walking with use their foot on the ground or to touch the ground also.